I believe the number one is probably the breakthrough of telehealthcare. Something, in my opinion, that will extend past this COVID crisis. With the lockdown orders that were issued by many governments and social distancing efforts, people who really needed care sometimes had no other option of bringing a kind of a virtual visit to their doctor. So that is, in my opinion, one of the big changes that we have seen during the COVID crisis. Of course, this is something that would not have happened if there was no increase in patients' acceptance for telehealthcare, because in reality, most people prefer to visit their physician in person. But of course, during the pandemic, many people were a little bit afraid of going to the doctor's cabinet, going to the hospital, because there was a possibility of contracting the virus over there. What you also see, and this is not only in APAC, but also in many other countries, was that there was a change in government support for telemedicine. So a couple of examples, for instance, Australia extended the Medicare coverage for telemedicine. South Korea eased restriction on telemedicine to treat COVID-19 patients remotely, because you have to be aware in a lot of countries, telemedicine is before the crisis was not fully accepted yet, and you could face issues of no reimbursement in some countries, among other issues, of course. Japan also launched like a very big project, a free government backed remote health service that used digital health tools. Before the COVID crisis, we already had like a kind of a trend in the market. So it's not purely something that was sparked by the COVID crisis alone. But there was a trend of many radiologists who were caring for a better work-life balance and who were starting to work one day at home. But of course, the pandemic just has accelerated that trend. So in my opinion, telehealthcare is on a growing path. However, please notify that it is not just an excuse to never visit the doctor anymore. It's a trend that is probably here to stay, but in a number of circumstances, a real visit to the doctor might still be the thing that you really need to do to get the proper treatment. We've seen, especially in the beginning, as these swab tests also got better, as the crisis evolved, that there could be a rather long delay between the moment the test was taken and the actual lab result. So this made first line triage very difficult. So healthcare workers at the front line have found the diagnostic value of imaging to be increasingly valuable, which has translated into clinical diagnosis of COVID-19 patient. So the radiologists therefore play a crucial role in the rapid identification and early diagnosis of a suspected patient. So as the pandemic evolved, several studies have also evaluated the findings that they got from these imaging, let's say, technologies. And they also help to better understand what really was going on with the patient. Like, for instance, if they noticed that the disease was in some part of the lungs, they could, let's say, rotate the patient on his belly to make sure that he could take in more oxygen. So what we also have seen, and I think especially in China, they were the first, of course, to be confronted with the virus, was that a huge amount of cases that suddenly popped up also triggered the rapid development of specific AI tools that helped to diagnose the disease. So radiologists, in addition to that, we've also seen that the mortality could increase as patient got a kind of a second infection on top of, let's say, COVID. So the radiologist could also help, let's say, identify if that is or was the case. A lot of attention to, let's say, keeping the hospitals in infection free. Just, I think you probably also heard about bacteria that are getting resistant against antibiotics. So making sure that there are no infections in the hospital is already on I would say on one of the number one priorities. And of course, now on top of that, we got the COVID virus, which basically was even worse because people, or let's say the healthcare staff, was, let's say, forced to even wear protective clothing to make sure that they did not contract the virus themselves, because that would, let's say, put further pressure on the healthcare staff if 20% of them got sick. So also these people are, let's say, very much aware that they themselves need to take sensible hygiene regulations in order to counteract the spread of infections, whether they are viral based or bacteria based. So they wash their hands regularly, they wear gloves, and take many other precautions to, let's say, prevent transmission of the virus or bacteria among patients. So that alone, I believe there are, if you look in some reports that were issued in the world, there were, I think, more than 1.5 to 2 million cases of healthcare associated infections per year. So that costs a huge amount of money to treat them. It's an average cost of about $45 billion a year. So it's huge. So there's also some, let's say, work that has been done, research work. They indicated that, for instance, a typical keyboard mouse screen as a huge source of, let's say, pathogens. So therefore, it is extremely important that you can also disinfect your equipment that you use, especially in the cases where there is a risk of contracting the virus. We've also seen during the pandemic that there were multiple reports that the virus could survive on certain plastic or metal surfaces. So it's extremely important. Medical displays are protected with a good protective cover that is not just a piece of plastic or so, but it is something that is medical safety glass that does not alter the optical characteristic, that has special high-end coatings that, let's say, make sure that besides preventing the spread of the virus, they also need to maintain the image quality on a diagnostic display. So these are all kind of things that you need to take into account.